breast cancer is affecting so many women. Last year, 680,000 women died of breast cancer. Many, many women can be saved. Only thing that is needed is early detection. Now, there is a test called mammography, but it does not work on women under 45 years of age. We use thermal sensing. It works for all women, non-radiation based, affordable, accessible. Just think about a day when you had fever and how the whole family was around you and fully messed up, didn't know what to do. That's what tells you how important your health is to your family, of course, to yourself. There is annual maintenance required for your car. Similarly, annual maintenance required for your body, right? So go for preventive screening every year, right?
Welcome to FemTech Forerunners by Miara Women. I'm Gayatri Muthukrishnan. We would like to welcome Dr. Geetha Manjunath to this episode. Hi.
Thank you.
Dr. Geetha Manjunath is the founder, CEO, and CTO of Niramai Health Analytics, and has led the company to develop a breakthrough AI solution for detecting early stage breast cancer in a non-invasive radiation-free manner. Geetha holds a PhD from IIC and management education from Kellogg's, Chicago. Apart from other awards, she was also in the Forbes list of top 20 self-made women 2020. She was recently awarded the Accenture Vahini Innovator of the Year Award from Economic Times and Women Entrepreneur of the Year 2020 by Biospectrum India. Geetha has been granted 16 US patents for her inventions. This is really awesome that you are here with us today, Dr. Geetha.
It's my pleasure, Dr. Gayatri.
Yes. First, can you tell us a little about yourself and what led you down the path of starting this project, this company?
Sure. I'm actually basically a techie. I did my computer science bachelor's, master's from Indian Institute of Science. And then I joined a research group, the first supercomputer developer, which is CDAC, which is a government research organization. So it was very, very good learning. And after that, I joined Hewlett-Packard Research Labs, the first member in India, long back in 1997. And then all these times, right? So I was trying to look at innovation, trying to come up with newer ideas with my team, and trying to make a difference on the ground, right? Okay, of course, we continue to publish, we continue to patent, but also how does it change life, right? That's always been a passion for me. And after about 17 years at HP, I joined Xerox Research to head analytics research for India. So this was Xerox Research in India, the whole of the AI work was being done. It was very interesting, very smart people to work with as well. And I was playing more lab director role, so a techno-managerial role. So I used to interact with a lot of customers, including hospitals, doctors, and so on. While we were trying to innovate for using artificial intelligence for, let's say, for example, detecting if a person can or will go into an ICU tomorrow. So how can we actually, take care of him or her much earlier than they actually become worse case and so on. Many of these ideas we were working on. One of my cousin sisters got detected with breast cancer. She was just 1 year older to me. And so it was very shocking because they said it's late stage, very few months to go. So it was extremely shocking for me. So I started reading up about breast cancer. And I would say serendipity or coincidental or God's grace, whatever, right? Now I met Dr. LK from my colleague, right, from the Palo Alto area, Dr. LK Mesta. And he was an imaging specialist. And I was casually mentioning about this and saying we should work in this area. Then he said, he started looking at some kind of imaging, different type of imaging that, was used for something else. He was working on some other problem, but he said, I've heard that this is also being used for breast cancer. So I thought it was a good idea. So we set up a project to try out using thermal imaging, just measuring temperature, and then trying to see if we can catch cancer. And so that is how the whole thing started. After about a year with my pet project, I decided, I want to spend the rest of the life on this because I felt it has an opportunity to save many lives. So I quit my job and started Niramai. So it's really, I call myself an accidental entrepreneur, because I really think that, we've been able to create something that can help so many women detect cancer much earlier in a very accessible and affordable manner. So I'd love to talk more about it later.
Yeah, no, that's, it's good that you became an incidental entrepreneur for all of us, I guess. So what is the problem in breast cancer that you're actually working towards when you're saying detecting?
Right. Actually, many women don't know that breast cancer is affecting so many women. Last year, 680,000 women died of breast cancer. But what is interesting and probably the positive angle is that breast cancer is not a death sentence. It is completely curable, right? That is what is the gap, right? Of course, disease comes to multiple people, and of course, it is the largest cancer killer. But many, many women can be saved. Only thing that is needed is early detection. Now, there is a test called mammography, which is using X-rays to detect whether there are small lumps in the breast by compressing between two plates and passing X-rays to it. But it does not work on women under 45 years of age. And it does not even work on 50% of the women above 45 years of age as well, because it uses this notion of finding white spots in the breast. Like, okay, we've all taken an X-ray or seen an X-ray, right? Let's say if I take an X-ray of my hand, my skeleton, kind of appears white, right? It's a black thing and like white, because anything that is hard is stopped by X-ray and it appears white, roughly speaking. So that is the principle of finding small lumps in the breast. But what happens in younger women, there's a lot of fibroglandular tissue, there's a lot of hormonal activities going on. The whole breast appears white normally, even for normal breast, the whole breast appears white. How do you find a white spot, white, breast? So that is the reason why even radiologists find it very difficult to actually find cancer in dense breast using mammography. Which means that the lady, many times accidentally finds a big lump and then she goes and it's to fail just accidentally, it's about 2 centimeters size, so it's already stage 3. So most women under 45 are detecting when it is actually stage 3. And so the treatment efficacy, the type of treatment, everything is like costlier and more uncertain, I would say, right? Some treatment may work, some treatment may not work, and so on. And also what is also been found is, as I mentioned, almost 50% of the ladies, even above 45, have dense breast, which is basically affecting many, many women. And there are alternatives, like you can go get an MRI done, but MRI is not like a screening, like an annual screening machine. So those are some of the gaps that exist. And closer home in India, mammography is not even affordable. Like, if it's a 3,500 rupees test, who will pay every year to get this done when all of us feel we will not get cancer? That's the sort of the mentality why spend 3,500 rupees. So that's also an issue. And so all of that will result, actually is resulting in 50% of the ladies detected with breast cancer dying in India and countries like India. And thankfully, like in UK and other places, there is government funding more, and there are more number of women who are going through regular mammogram, but younger women are still finding it late. So all of these are the issues we found, and that is also the reason why I lost my cousin sister. So that's always at the back, and there's so many women who are similar positions. So what we have done is instead of using X-ray, we use thermal sensing. Right. So thermal sensing is something that everyone is aware of now because of COVID, right? You get into any building, there's somebody holding a gun to just check your temperature, right? So it's exactly the temperature measuring instrument, but it's a high resolution, high sensitive temperature measuring instrument, which is like, this size, a small thing kept in front of the lady. The lady sits like this for 10 minutes. and the whole body's temperature is quickly measured after some preparation. And that's about it. This temperature variation, that is 400,000 temperature points per person, which is measured, is actually analyzed using a smart artificial intelligence-based software that we've developed.
Okay.
And that generates a report. It says that whether there is an abnormality, if so, what is the likelihood that it is actually cancer, and where is it, so that you can have a follow-up diagnostic test. So all this can be done automatically using the solution. And so that's the sort of the key thing. And there's several advantages of it. Maybe I'll pause here and see if you have further thoughts.
Yeah, no, it'll be good to know the advantages. Just one question is, so I saw reports that you do use thermography for imaging, but what is the difference between general thermography and what you are doing specifically?
Oh, it's an excellent question. Yes, if you Google for thermography, you'll get all kinds of information. FDA has said that you can use thermography only as an adjunct modality, that is along with something else, because thermography has been around since 30, 40 years. In fact, in 1984, US FDA approved this as one of the modalities for breast screening. But when they started doing it, what thermography does is, yes, it measures the temperature variation on the chest area. But thermography requires an expert to visually analyze these temperature variations. As I mentioned, there's 4 lakh temperature points. How can a human being look at these temperature points at 22.5, 22.6, 22.7, or 36.7, whatever, at that whole range, and do the analysis? That is where it has actually suffered a lot, because there's so many reasons why there can be an increase in temperature, and people, when interpreting with bare eyes, are actually making a lot of errors. While thermography can actually detect cancer much, much earlier than any other test, because even normal patients will look like cancer patients, it's very hard to differentiate. That has always been the problem. So what Niramai has developed is Thermalytix, thermal analytics, which is basically, we use thermal camera, but rest is all completely different. We use this temperature and we model it using a sophisticated statistics and probability-based model, which is like machine learning-based models. And we are able to, you can maybe roughly say that we are able to detect 117 different types of abnormal patterns, or a combination of that, all of it in 2 minutes, whether such abnormal patterns exist or not, which obviously a bare eye or an analysis by any human being is very, very difficult. So this modeling has helped. And that is a major difference. Like the smart software, which is using the temperature, is what we have. It is not thermography, right? Thermography actually requires you to come twice, and like it's actually has quite some issues.
Okay. Yeah, no, it's thermography plus the smart software behind it, AI-based, artificial intelligence-based software behind it. That the combination is what makes it unique compared to thermography.
Absolutely, because computers can crunch, as you know, right, the data at like much faster rate, much large volumes, and nowadays you're getting fast computers even in a mobile, right? So all that information is actually used in a very, very simplistic manner.
Okay. Yeah. Now coming back to the other point, you said the further advantages of Niramai product. Yeah.
Sure. So one of the things I mentioned is that it does not, like mammography does not work on dense breasts or younger women.
Yeah.
So thermal imaging does not go by density of the tissue. It looks at the temperature of the tissue or activity of the tissue, which means that abnormal tissue activity is what we are looking at. It is irrespective of the density. It is irrespective of the age. So it does work on women of all ages. And I mentioned that earlier that, women are detecting by hand, it's 2 centimeters. Our test is able to detect at 4 millimeters. It's like less than 5 times smaller. And so it's much, much earlier than what a hand can detect. In fact, everyone needs to go through this test once, after 20, 25 years, because this test can detect even before any symptom appears, right? So that sort of is very, very important, because early detection means very simple procedure to solve it. and people can go back home. So that's another major advantage. The third advantage is that there's no radiation. That is, we are not using X-rays or anything. We're just measuring temperature. Like a thermometer, do you worry? Like I put my thermometer in my mouth, like tomorrow morning, do I need to do? No, you don't. Like, you can do this test as often as necessary for the lady, especially if it's a daughter of a cancer patient. She's likely, her risk to cancer is slightly higher, but doesn't mean she gets cancer always. But still, it's good to actually get the test done every 6 months, just to be on the safer side, right? So these kinds of varying of interval between the is possible only with this, but you cannot do that for mammography, for example. So this is another advantage. The cost is also a major advantage. The device itself is like less than 1/10 the cost of a mammogram. And in fact, we are now working on a mobile phone attachment, which is 1/100th the cost of a mammogram, which is a mammography machine. So which is very, very, important for countries like India, where you want to address the scale, right? And then get this into every village and so on and so forth. Last but not the least, as I mentioned, it's really a small device, right? So, you can do it in a hospital for sure, because we've proven that it actually works as well, or even actually slightly better than mammography in terms of accuracy. You can also take it out to do trainings in rural areas. We've started home screening. So this portability and accessibility increase is another big advantage that we have. So works for all women, non-radiation based, affordable, accessible, and most importantly, the last one, but not the least, is that it is privacy aware. Nobody touches you or nobody sees you without clothes during this. And that's never heard of for breast cancer. So we create a booth-like structure. The lady enters into the booth. She sits in front of the device. Even the technician is outside the room. It's like a changing room experience. Just close the door and sit inside. Of course, you have to remove the top clothes, because otherwise you can't do a breast test. But nobody sees you without clothes. And this privacy awareness has made a huge difference for the adoption, because people feel comfortable, because the key thing is to not dread for a disease. Like, you're not going to get this test done because you feel you have cancer, or I feel you have. No, it's not like that. We're doing it like a regular, like a glucose test. You're not expecting that. You're just measuring the sugar, or measuring your weight, measuring your height. Like that, you just measure the breast health. That simple we wanted to make. And for that, making the experience simple was very, very important. So it's a privacy aware experience as well.
Oh, no, that is really important, because there are issues a lot of women have with going for a test because of this. I mean, even I have heard that mammography is very painful and makes you think twice. Is it really required? If I don't have a history, if I'm still young, do I really need to go for it? And it's a question always at the back of your mind. Other than the fact that it's not private, or the privacy is also not there, and it's also painful. So this is very interesting. Coming to one question about, again, going back to the thermography part. The reason that thermography detects cancer, I just wanted to put it out there, it's because there is more activity, the blood activity there, right? How is the higher temperature?
Blood activity, yes. And also there's more activity. So in general, the cancer cells are dividing at a much faster rate compared to the rest. And they're also dividing at a much irregular rate. So it results in an increase in temperature, and because of the higher metabolism, and also a nitrogen oxide is generated. So the cancer cell itself is at a much higher temperature, almost 2 degrees higher than the rest of it. However, as you said, surrounding the areas where the blood flow is there also we see a lot more blood vessel activity, vascular activity. So both of these are very, very important to actually identify early cancer. Because the lesion can be very, very small, a few pixels, so it may get missed out, but because the activity around it is like more active than, for example, the other breast. Usually people get a breast cancer in one breast first, right? So it doesn't happen simultaneously in two and all. So because of that, the symmetry between the left and the right side, in terms of thermal signature, in terms of vascular signature, as we call it, are going to be very different. And that gives away, the issue very quickly.
Okay, thanks for clarifying that. So now, what does this mean to a woman sitting at home? What does she have to do to access this, or how does this help her?
Right. So There are a couple of ways to actually get to Niramai test, right? So because it's a very portable device, and also because in COVID time last year, all of us hesitated to go to a hospital for non-emergency reasons, right?
Yeah.
Because we were worried that there would be COVID patients there and we'll pick it up, but all of those actually happened as well, right? So that's why we launched home screening last year. So especially if people, some of the viewers are in India, they can just come to our website, niramai.com, and register for screening. And our team will come home and do the screening at your place, right? Completely safe from COVID and all of that, right? It's non-touch, as I mentioned. So that is possible. Our test is also available in multiple hospitals. So you can check out on our website. If you are living close to a clinic, you can just walk in and or give a phone call, take an appointment and go in and get the test done. Because the test hardly takes 15, 20 minutes, including all the things. And so that's sort of the one thing. And so that's usually how we do. And many of our, some of the women, like they want to conduct camps in their own apartments. They'll say, okay, on this particular day, why don't you come in and do it? Like we will be 20 of us, we want to do it together, and they get some discounts and so on and so forth. So we have these camp mode as well. So all of that, can be accessed from our website, www.niramai.com, and then they can register. For Europe, we've just got the regulatory clearance. So we are working in multiple countries with the doctors to make this available as we speak. And if there is a specific interest, they can write to us, and we will connect them to the doctor in that country who can provide it right now.
Okay. And you said this is also for very women at a younger age. So like what age do you think that they should start thinking about the screening, and when should they start going in for screening?
Yeah, so any person about 25 years of age should get at least once screening done. And as I mentioned today, mammography is not recommended until there's a high risk, like below 45, it's not recommended. So the suggestion is, of course, they can take a Niramai test. Sometimes, even ultrasound, breast ultrasound is used, but it is only if you have a lump or some kind of a symptom, then a breast ultrasound is actually recommended. So at the age of 25, getting a screening done, and it generates a score. And based on the score, you can decide whether you want to do it like once in a year or once in 2 years from then on. So that is the thing. And in addition to that, what we all recommend, right, everyone working in breast area is to do a self-breast examination at least once a month, right? Yeah. You can fix up a date and do it, or actually 5 days after the menstrual period is done for the month. Stand in front of the mirror and then do the self-breast examination to look for any lumps or any discharge from the nipple. So these kinds of symptoms need to be checked. And there are several videos giving how to do self-breast examination. Happy to share with your audience if you like, we
have our own, actually we have created a guide, so I can add it along with this video, a link.
Sure, we have a separate video, animated video we have created. You can share that, say how to do the self-breast examination. That can be done like anytime, even 20 years and later. But I think going for a formal test is definitely helpful, because as I mentioned, finding it on our own is actually at late stage, but just that's it's a fallback mechanism.
Okay. No, this is good to know that you can just start at 25, you have one test, and then decide when the next tests have to be after that, after that report you get from them. And so what is next for Niramai? What are you...
Right. So far, Gayatri, we have actually established, I think, fairly established in India, though, of course, we're still working with the government for the government adoption, and you know how the government adoption itself takes time. So while that is happening, for example, we've got like one of the largest hospital chain, Apollo, fully adopting our solution in multiple clinics, multiple society clinics, maybe 25, 30 clinics of Apollo already has this. And also HCG, which is a cancer specialist, as they call themselves, right? They also we have it with multiple hospitals of HCG. And many others, such 70 plus hospitals actually provide the Niramai solution today in 16, 17, maybe more cities right now. Now, recently, we've got approval for Europe, Africa, and some parts of Asia. So, we've started in Africa already, in one of the countries, the screening and diagnosis with Niramai test. And we have now started exploring multiple partnerships in Europe. And in fact, some of the demo and some of the doctors have already started using it for evaluation. So we will be expanding to Europe, and our US clearance is halfway through. We got a favorable response already. So we just have to produce some more documentation, and we're hoping to have that cleared in a few months now as well. So expanding is one thing. Second thing is we also want to reduce the costs and make it more affordable and portable for, let's say, villages, and be it like, literally every village should have it, or make it possible for cancer like societies and things like that to actually reach out to them and provide it free if possible. So we're working on a very simple, nice model called My3, which is a very portable device which can be used along with the phone. And in fact, if everything goes well, it can become a self-screening device. It comes to the affordable bracket of educated women like the audience here, who can actually buy one and keep it at home. Instead of doing a hand examination, they can do a quick scan themselves in the bathroom. That's sort of the thing that
we're working on.
Right. So multiple interesting things because there's a lot of innovation. Nobody else is trying to do this. Have done this. Of course, there have been research efforts in pockets, but doing it at a systematic level as a production kind of quality one is something that we are unique. So we want to leverage that leadership position.
Yeah, that will be great. And we're looking forward to it. So any last words, advice to women about their health, general, and what they
Absolutely. And of course, I want to thank you for giving an opportunity to talk to your audience. But what I want to really mention is that, usually women try to keep their health or priority of their health much, much lower than priority of health of their children, husband. Definitely, that's important. And I too do that, honestly. Having said that, just think about a day when you had fever and how the whole family was around you and fully messed up, didn't know what to do. That's what tells you how important your health is to your family, of course, to yourself as well. So I think one is prioritize your health. I think it's absolutely critical, particularly for women. I will call it out, and make it more preventative in nature. Don't wait for the car to break down to actually get a repair done. There is annual maintenance required for your car. Similarly, annual maintenance required for your body, right? So go for preventive screening every year, right? As in general annual health checkups, could be BP, sugar, of course, include breast also, because here is an organ which can actually take away a life, and all that requires is 15 minutes of your time every year to just stay very, very healthy. So I think I will say stay safe, stay healthy. Please take care of your health. And of course, do about 20 minutes of walking at least, or some kind of physical exercise to keep healthy. And if possible, do some yoga, meditation to keep your mind healthy as well.
Thanks for being on the show. And thanks for telling us all about Niramai. And all the women out there, please take care of yourselves. Go get yourselves checked. Do the self-breast exam. With the videos, with tutorials, we have it all on all our sites. And also then get your, go book your Niramai screening and get it done soon. Thank you.
Thank you very much, Dr. Gayatri. It was a pleasure speaking with you and your audience. Bye. Have a great day.